Good morning, good morning, good morning. I apologize for being a couple of minutes behind. I was in the wrong studio. When you're walking down the hallway and you can't figure out where you're going, you just go someplace. And that's what I did this morning. So welcome to another episode of Strictly Business, sponsored by Edge TV Network. Thank you so much for being a part of what we're doing this morning. I'm going to have a special guest come on in a couple of minutes, but I wanted to talk to you about systems this morning. We had our board meeting at the Southern California Black Chamber of Commerce last week, and all of our 13, 14 chapters were there, and we were talking about creating a system to make things work. So if you have a small business and you haven't put in a system yet, a system that makes every Big Mac out of McDonald's taste the same. So if once you get a system in place in your business, which we will be talking about later this week, and how to form a system and how to make a system work, I want you to think about how each step of your day, whether it's in a brick and mortar or whether you're selling out of the trunk of your car or whatever you're doing, you need a system in place. What happens at 9? What happens at 9:05? What happens at 10? What happens at 10:15? So you must have a system in place so that your business can prosper and move forward and be consistent. Consistency is the key in business. I don't want to take up a lot of time because we've got a show this morning that we have the Green Foundation. And I know you're saying, well, Rich, what is the Green Foundation? Hold on for about 30 seconds and I'll be right back to tell you what the Green Foundation is all about. Good morning again. And I am going to be bringing on Miss Wright right now so we can find out exactly what the Green Foundation is. Good morning, Miss Wright. How are you this morning?
I am wonderful. Thank you. Good morning.
And thank you so much for taking the time out this morning and being a part of Strictly Business, show sponsored by Edge TV Network. If you would take a moment to introduce yourself to our audience and then tell us a little bit about the Green Foundation.
I am delighted to be here with everyone this morning. And thank you so much, Rich, for the invitation to be able to share what the Green Foundation does. Yes, GREEN is an acronym, but it stands for Gathering Resources to Educate, Empower Through Network. It is our mission and it is a part of our vision. And I am the executive director, and I often not share that I am the founder of the organization. For over 25 to 30 years, we've been working in community to providing health education at the local level to African Americans to make sure that they understood how important it was to take care of their health. And being an entrepreneur for over 35
And
years
as
myself.
Miss Wright has explained what the Green Foundation is, I'm jumping in because it's frozen on my end. I hope it's not on your end. We're just
It is.
spinning. It isn't? Okay, fantastic. That's great. I have Spectrum, so out the door with Spectrum. But once again, tell us what I want to. You made a statement in the beginning, and you said you don't often tell people that you're the founder of the Green Foundation. Why is that? Because I find myself sometimes not telling people that I am the founder of the Southern California Black Chamber of Commerce and I don't know what the real reason is. A lot of times is that I don't want to pour the attention on myself. It's more about what we're doing as opposed to who we are. What is your reasoning for not necessarily spouting out, it's me, oh Lord, I'm the one that put this together,
Same exactly what you expressed is that I wanted the focus to be on the what we do and not who I am, and that I'll let what the oftentimes of a legal term, let the evidence speak for itself. So let the work that we do speak for itself. And so I want individuals to see how and what we do in the community and how serious we are, and not take away from what the work that we're doing, that the emphasis would be on what we do and why we do what we do, and to be able to bring resources and all the attention to the much needed support in bringing healthcare, as well as creating healthy communities to our African American Black brothers and sisters.
Okay. Well, let's just get into the foundation and on a day-to-day what you do. You're on the health side, you're on the mental health side, you're on the physical health side, but you're also on the business side and the education side. So you got a lot of components there inside of the foundation. And if I came to the foundation to look for services, I guess, what would be the obvious or the services that the foundation would begin to offer to the community?
We provide community comprehensive health education. So we take complex language. We often get in brochures from our health providers or from our doctors of how to stay, maintain a healthy life. But we break it down from that language to be able to make sure that individuals understand how important it is to navigate the healthcare system. For a good example, why prevention is important, why certain screenings at
And
certain
once
age
again, my
levels.
spectrum is kicking in. Okay. All right. So, is it the information that you get to the people about their health care that makes them more aware? You say you take the language and you kind of break it down so people understand it a lot more. Is it medical doctors, or is it a specific case? Or we're working now with the City of Hope on some cancer projects. Is it projects like that that the foundation takes on?
We started off with breast cancer because we had realized in Orange County specifically that African American women didn't understand how important it was for screenings, for mammograms or self-examinations, and that literature was not being shared in the African American community. How important it is to get a mammogram at the age of 40 at the time. We say now women who are risk for family history to start looking into getting a mammogram at the age of 35. So we're just bringing in the information from the Centers of Disease Control or Health and Human Services, the information to be shared in a local environment through workshops, through training, through distribution of health education materials. And so we do activities and outreach and community engagement to constantly making sure people understand that this too is necessary for you to live a
And
healthy life.
and I don't know if you're still speaking or not, because I have this great internet service. There we go. Okay, if I had most communities that we service have the basic, or if any health insurance, it's pretty basic. A mammogram, is that an expensive process, or can that be done at one of these health clinics that are on the corner? Where would a young woman start? And especially if if you're on whatever services you're on, if you don't have anything, is it an expensive process, which is why most people don't do it? Is it very time consuming? And I don't know about that. So I'm trying to figure why. I know why men don't go and get the prostate test. You know, they think of it as being a painful situation, or being a situation that they don't want to deal with that particular time. Is it different for women being tested for cancer? Why wouldn't it just be a natural thing for a young woman to go and do that? Is it cost involved? What is that process?
It could be a combination, and it could even be a barrier for just the mental state of your
I'm
environment, what
assuming
you
she's
think about the
answering me.
healthcare. I'm able to still talk. I think you might be frozen.
I imagine that you said something very good, because I didn't hear it.
Well, I didn't finish because I knew that you were frozen. But to answer the question is, before the Affordable Care Act, the wonderful act that often is called the Obamacare, which I prefer not to use Obamacare because I like to use a proper name of Affordable Care Act because it is a law and it is the right of individuals to have essential benefits. Essential benefits is a part of the screening that you referred to for mammograms. So anyone that have health coverage, whether it's Medi-Cal, whether it's through your PPO, whether it's through a HMO, that
Yeah,
that
we
is a
hear about the Affordable Care Act being expensive. We hear about the Affordable Care Act being expensive. I listen on the news. One group says it's the worst thing in the world and it raises your insurance premium and da 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 da. And the other group says, oh, you need to have it signed. In fact, I think because of a new bill or something, there's a lot of people right now, insurance agents, calling folks about the Affordable Care Act, about getting in, about stepping up their Medi-Cal or Medicare services. There's a big push right now in getting people insured in the Affordable Care Act or just plainly because I'm getting an average of, 5 or 6 calls a day about that type of thing. From your understanding, it sounds like the Affordable Care Act is something that people would utilize a lot, but from Fox News or other outlets, it sounds like it's a horrible situation. What has your experience been with the Affordable Care Act?
Well, when the Affordable Care Act was released, the Green Foundation was at the forefront. We were an entity literally licensed to be able to bring in individuals to train to be able to offer health coverage to individuals who didn't have health coverage. So I see it from a lens of being firsthand and in the forefront. It is the step in the right direction for individuals to have health coverage. Yes, some insurance or some individuals had to pay a little bit more, but there are also individuals who didn't have health coverage had an opportunity to be able to have health coverage, and it didn't matter your employment status. If you're not employed, it meant that you are eligible for Medi-Cal, and if you are employed, that it still was attached to your income, that it was a certain amount of coverage as well as a certain amount of premium that wasn't able to go over the threshold. But sometimes it did feel a little bit more costly to others. But with anything new, that the cost sharing had to take place. However, it was something that was so important that an individual didn't have to go to the corner to the clinic, that they could have their own primary health care doctor. So they didn't have to feel uncomfortable going and looking and scrambling around to a clinic or urgent care if they didn't have health coverage. Now, those services are truly important for those who are in a situation even currently, but our belief as an organization that it is a human right for everyone to have health coverage, no matter what your employment status is.
Isn't that ridiculous that this country is as rich as it is and health coverage or housing is one of the major problems that we have here in America with all of the things that we have available to us? They're really not available to us unless we are in middle class or in a financial situation to be able to make things work better. Is there, does the foundation help with getting people back on their feet? Do you have a facilitator? Do you have a work program or a training program that a lot of people that have training for, let's say, forklift drivers? I was at a factory a few weeks ago and they had machines driving the forklifts up and down the aisles. They didn't have people on them anymore. So does the foundation do any possible retraining or send them to places that they could be to get back at a level that they believe they were at one time?
Well, we're a community health organization. So we are here to help you navigate your health coverage. We're here to help you understand how important it is to stay healthy so you can go ahead and operate those systems, go ahead and operate the machines, go ahead and being able to be an entrepreneur or run your business. We want to keep you healthy and not at the same time to make sure that you understand what your rights are as it relates to health. And going back to the coverage for health coverage is that there's 13 essential benefits no matter what level income that you have, no matter what type of insurance you have. There's 13 preventive services that everybody's qualified for when you have Medi-Cal, whether you have HMO or PPO. It doesn't matter. The other side is the advocacy side. We do train individuals on how to fight for yourself, how to ask the right questions in the healthcare environment, but it also is translatable into your work environment, right? So if you understand and have the confidence of knowing what your rights are, you're able to go to HR and saying, well, why I don't have health coverage? Or if your premium been increased, that you know how to articulate how and what you know that your benefits cover, or what you know that is rightfully yours. And even going to a doctor's office, that you need to know how to articulate your own health coverage, because your doctor don't know your health coverage. The nurses don't know your health coverage. They know how to provide medicine. They know how to do health care. That's not their profession. It is up to you to know what your health benefits are. And that's where we come in, is to teach you what your health benefits are, or to learn and share with you how to go to your health provider to make sure you fully understand your benefits. Because, right, it could cost you money. For a good example, if someone is hospitalized, a person is automatically should be talking to a social service worker that is assigned to them in the hospital. Oftentimes, communities of colors don't know that's their right. That social worker has a list of what resources that you as a patient have access to when you release. For a good example, depending upon why you're in there, that you may be your benefit may be you get a food on wheels because of, you're not able to move around and cover, or you don't have support, or you may be eligible for a certain types of medication that you didn't know about, or you may be able to have a service of someone coming into your home for 2 weeks to help clean up your home. You may have a nurse assistant that were able to come in X amount of hours to help you with your rehabilitation. That's all about coverage. That is not coming out of your pocket, but it's coming, and it's a right that you have. But if you don't know that, you wouldn't know how to take advantage of benefits that are rightfully yours.
Yeah, are these benefits spelled out in the insurance policy, and you walk them through how to activate them, or are they just county service benefits? I have a health policy, but I am a veteran, so I do a lot of my stuff at the VA, or these kinds of things. So because a person doesn't know, they just say it hurts right here, and that could be a migraine, that could be arthritis, it could be a lot of different things, but it affects something else in a person's body. So do you and do I just pick up the phone and call the Green Foundation? I'm trying to get how people get to you
Well,
involved
we
in
don't
you
we
guiding
can
me through my healthcare situation. Is that Green Foundation a foundation that's free for the public, or how does that navigate? How do I navigate to the green system, and how would I navigate once I'm in?
Well, we are a resource of how to share with you how to interpret your health coverage and connect you to the right resources and the right dots, connect you to the right dots based upon your own unique situation. So if someone says, for good example, that they don't have health coverage, and they feel that they haven't had a mammogram in a few years, well, we will share with you how, one, to get health coverage. that we will ask you the questions, and then we will refer you to a person that will help you enroll in health coverage, whether we send you to Covered California, whether we send you to an insurance agent or a certified enroller. So we help you get to the next dot. So we educate you to help you navigate to the next area for your life. So you would use us as a in-between resource, if you will, that if your coverage, we would tell you if you need to know how to interpret, like you have Blue Shield of California. Well, we'll have you to contact someone from Blue Shield of California so you can get those answers. So we direct. So it's somewhat of a 211 system, but it's at a local level that oftentimes individuals don't even know about the 211 so resources in your community. So we are here to share with you what resources that are available to you in your community and help you articulate and help you get guided in the and navigate in these systems. For good, another example, in the hospital system, if you go to any hospital, as large as they are, and said that you want a prostate examination.
Okay. Frozen on my end again. Oh, here we go. You mentioned 211 services. I have one of my board members out in the Temecula area. We're preparing a survey that she wants to do on the disparity of health insurance in minority communities. Does 911 get the ambulance there faster based upon your address? Does the information, as you say, doesn't trickle down to people in our community service sometimes in the hospital? And I'm just listening to you, and it's basically because we don't know which questions to ask.
Absolutely.
We don't know when the answer comes in what I call a 50-cent word. That word is not broken down for us to understand it. So they're doing a survey on the disparity of health service in the minority communities because of the information that we don't have. So is that something that we just know about, or is a whole survey finding out how 911 really works based upon your zip code? Is that something that
It's a combination of all of that, because we know historically that there's a big disparity gap. And I don't like using disparity because that's a nice word of saying purposely not giving the rights to all. Disparity is just a nice little term to saying that we know that we're not giving the best service and the quality of service to some groups. So I like to just call it out the way it is that it's intentional, and the goal of the organization is to inform and to educate our communities of knowing how to access services without not knowing. And this is also true in other sectors, even in the business sector, that oftentimes when the pandemic hit, a lot of small businesses, as you know, didn't know that there was loans going out or grants because that information wasn't being shared. So we are considered the Green Foundation like a go. We are those that bring highlight to individuals, to enlighten individuals what opportunities that are out there and how to access them, and to continue to seek on your own and to teach and to guide you of how to get the right answers for you and your family, because everybody is in a unique way. So we're here to help you, to guide you specifically on your own case, but on a broader level to let individuals know in the Black communities that there's resources that you don't know nothing about. And so we like to just be able to use a bullhorn, if you will, to let people know that it's available. And then moving back to when Covered California, when we were part for 8 years, that the purpose of the organization get involved in that was to strictly to let individuals know in the Black community that the health coverage is for them and how it will work for them and not against them, that it was a good thing. Not that it was picture perfect, but nothing that's rolled out, but it was definitely going into the right direction and being a benefactor. I believe I was a benefactor of being an entrepreneur for a number of years. My health coverage was ridiculous. So I was able to do a la carte, though, that I would tell business owners at the time that, well, even you don't have to get health coverage at the time, that if you needed to get screening, just pay for your screening for a mammogram. Then you didn't have to worry about a premium every month. But now with the health coverage, the mammogram or your prostate screenings are all included. When you pay your monthly premium, that is also included in the premium. So you're not paying that out of pocket any longer. It is a part of the premium that you pay every month. It's included in that same amount.
So now if I pull out my insurance policy, my health policy, and there's a lot of 50-cent words in there that I'm just not going to be clear with. The language is health language, it's doctor language, or it's insurance language. Either way, I'm a plumber. I don't understand any of those languages.
Mhm.
So would I call my agent and ask him to walk through? Because most agents today, I'm not picking on the insurance agents, but if there's not a sale in there at the end of this, they pretty much are not going to walk you through a detailed policy. Nowadays, years ago, when you sold insurance, the agent would come to the house and he'd go over step by step what you just bought. Before he would leave the policy there. Now they just mail it to you, or send it in an email, and you got this 24-page document with 10 or 12 point type in it all the way. And you need to understand what's in it because you signed for it. And in signing for it, they assume that you've read it. They pretty much know you haven't. It's like signing for a rental with 5 or 6 page documents and sign here if you want the car. You're standing there and go, well, if I don't sign it, I'm not going to get the car. So I need to rent this car so I can move on. In the health insurance situation, you get that policy in the mail or you get it in your email. And now you're like, okay, I have it. And I remember some of the stuff he told me I was going to get when he was here selling it to me, or when she was here selling it to me. So now I have to remember, does the foundation, if I give them a call, will they sit with me and go through the policy? How am I re-educated on what I just purchased? Or should I be having what they call adding a rider to it that covers cancer, or a rider to it that covers ear, nose, and throats? What does the foundation help me navigate before I get sick? Because when you're sick, you're sick. It's like, okay, I just need to be healed. Yes, ma'am.
Sure. And it's a good question. If you contact us, we will find out what your health coverage, who and what the policy. I would guide you how to go back to your agent who sold you the policy and ask the certain questions based upon what you're trying to discover. But we also advocate that you will need to read those 24 pages because you signed for them, and that how to walk you through that. But we don't take individual policies. We don't give advice. We give you advice of how to get the information that you are seeking. So if it's a health insurance coverage, we would say we do have referrals that we send out. We have very friendly agents. We would say, why don't you set up an appointment with the agent and go over this area? Because we also know that you can't understand that whole policy in one setting. I would recommend that you would do every month, sit down 15 minutes and go through your policy with the agent so you have an understanding, because when it's you will be the ultimate user of it. So you need to know what's in your policy to take advantage of them. So we would either have you to talk to an agent, or we will have you to talk to the provider. Like I mentioned, if it's HealthNet, then we will have you to contact. We have individuals that contact the HealthNet agent to talk about what you have, and that's what their job is, to do that, to be able to do that. And then if you called us back and saying that the agent didn't call you back or you didn't like, well, then our role as advocate, because our role is more on the advocacy side for you to contact us, and then we share and show you how to get the product, the services that you need by guiding you and directing you how to get the support that you're needing.
Okay. Now
So
you're
we're
in
like
Orange County, 714 area down there. And are you advocacy for a nationwide situation? Because we're streaming. I'm looking at some people in New Orleans, and I'm looking at some people in Washington, D.C. So if I'm trying to get some information, and it sounds like you're similar to what the chamber is, we're a business organization, but more so we're an information resource center. We get the information and make sure that you have not just the personal, but a wide range of information that will allow you to be able to understand that policy that you have, or even your health insurance, period. Because we know we need health insurance, we know we have car insurance, but you don't know what your car insurance policy says until you have an accident and they go, oh, we don't cover rental cars. What do you mean? I don't have a transportation, and I thought my policy, because we didn't, like you said, ask the right questions. Is there a frequently asked questions sheet that may be on your website or something that people will be able to questions that you need to know about, or that you need to ask to get movement in your health coverage policy? Because the agent's talking fast. He's trying to get you to write a check for a year or 6 months or whatever it is, or to take it out of your paycheck or take it out of your account every month to make that sale. And he's gone on to the next sale. So the questions that I should ask, I don't know to ask. So is there a form or a sheet or just a possible which questions that
we don't have a fact sheet on our website. Again, we're health education informed, and each
I'm assuming
individual's
she's answering
policies.
me. There we go.
Each insurance and each individual is unique. So we don't have a list. What we do is give you an overview of what you are able to understand about your health coverage and understand why it's important to know your benefits before you need them. We give you the general and the overview of how to access your support. And you mentioned about whether or not we are in Southern California. However, we are nationwide. We've been not nationwide, excuse me, statewide for since 2012, where we would go and do comprehensive conferences. And that is the reason why I'm emphasizing we do trainings, we do workshops, we do our listen and learning sessions, we do lunch and learn to give people an opportunity to come to these workshops, to get information for themselves, because everybody's unique in their own way and policies vary. So there's no way that we're able to do that. And so when you come and attend workshops that we have all throughout the year, we've been doing our conferences, which is a comprehensive conference. When I say comprehensive, meaning that we bring in the experts, we bring in the medical doctors, we bring in the pharmacists, and also they are formatted in a way that they're not just talking heads, that is only 15 to 20 minutes, because ultimately we want the Q&A sessions, we want the discussion. So when you attend these workshops, the conferences, that you're able to attend and to address a concern that you may have in these settings. We don't look for 300 to 400 people to attend, because people don't ask questions when it's 300 or 400 individuals. So we like to offer intimate settings and intimate learning environments to really dive deep for individuals to get what they're needing. So on the broader spectrum, we do the advocacy training, meaning going back of how to be an advocate for yourself, meaning that you look at your policy, and if you don't understand it, that's when you go back to your agent who sold you the policy, because that's their job. So when you articulate in a way to be able to get the services that you're needing, you're going to learn little by little. And we also ask and share and teach how to do that. So you need to be able to set up once a month, every quarter. Personally, I do every 3 months. I go through all of my insurances, all of my legal stuff, and then I make phone calls. Did anything get updated? What is it that I don't understand right now? Ask
Okay,
the
I'm
question.
assuming we're still going. Okay. I do have you have an event coming up. Can you tell us a little bit about a mixer or something that you have coming up?
Sure, it is. It is a business mixer, and most of your audience may or may not know. August is Black Business Month, and that we are collaborating with several organizations, and now happy to know that Southern California Black Chambers is going to be participating as well. At the Museum, we collaborated with an organization that we've been working with that has been working in tobacco education for a number of years. That's an international movement, a nation movement of how tobacco industry has targeted African Americans. And of course, we've always been in the space for tobacco education because we know that tobacco has taken out a lot of our family members and friends because it is directly related to a lot of different cancers. And so we have a business mixer coming up on August the 25th from 5 to 7 p.m. with light refreshments to highlight an exhibit that's called the same game, it's the same game, same results, where it's highlighting historically how the tobacco industry has targeted African American communities to sell their products and how successful they have been in so many years, and how it devastated the Black community of addicting individuals on tobacco. And so again, that's August the 25th from 5 to 7 p.m. There will be a guided tour. It will also be an opportunity for owners and business owners to get a chance to connect with one another. And I am a networker. That is not to come just to get business cards. It is to really genuinely to get to know someone and then be able to make a connection after the event. But it's combination of health, because we do know that you cannot be a successful business owner if you're not in good health.
So you're frozen on my end again. Okay, here we go. So we will have something on our website at blackchamberofcommerce.org. We will also look at, I'll talk to Ms. Wright, and we will also look at an opportunity to be able to have a link on our site to be able to link that health information from a business person. Go to the Black Chamber of Commerce website, and we'll guide you over to their website so that you can connect and be able to get the help that you need or the information that you need. And services like this are hidden jewels, best kept secret in the closet. So we want to get that out of the closet, so to get it out to the minority community, so that we can get the services and the help and the information we need. Because information is knowledge, but engaging, and once you get that knowledge, don't sit on it. Number one, share it. Number two, engage to be able to keep yourself healthy, because your health is only important to you. You know, it's important that you stay healthy. We have services like the foundation that be able to help you get that information so that you can stay healthy, so that you can be in business, so that you can multitask, so that you can do these things that you have the vision for, and that you can go out and get the provision to be able to make that vision come true. But when you're not feeling well, when you're not knowing how to feel better or what you can do to feel better, because sometimes you can do things to feel better. A lot of the hospitals today, Miss Wright, or doctors are now doing video calls to keep you from coming into the facilities and these kinds of things. And I'm not sure if the policy covers that or if it's a new thing that doctors are trying to do, but they could cover probably more things online than they could people walking in and sitting in emergency for 6 hours to get things done. Are you familiar with these new video? And I don't know if they're video doctors or is that something that insurance companies are now looking at adding to policies, or is it already in there?
It's called telehealth. And I like the idea that progression, I like the idea of giving people options. That's another option that is not a fix for all, but it's nice to know that you could contact your medical doctor to find out, ask questions without getting dressed, going down, sitting in the waiting room and sitting and even exposing yourself to other individuals in the waiting room. But that's telehealth and it's an option. So I just like the idea that there's more than one option to be able to get the support that you're needing. So yes. And to remember from for your audience to know this is all universal information.
And I think you're frozen again for me, but I do have a question about the suspect that in our communities there's a lack of distrust with hospitals and doctors that came from centuries ago that has spilled over. I think the millenniums are maybe a little bit more comfortable with doctors, but as opposed to people around my age or even older have don't believe that they're really doing the best that they could do for our community. Is there, are you running into, or have you talked to people that just flat out don't trust?
We do. And that is a part of why the Green Foundation exists, is to help close those major gaps. And that once you are more informed and educated on what your rights are and what your options are, will give you a better opportunity to get the health support that you're needing. For good example, in one of my workshops, I would say, if you're not comfortable with a medical doctor, if you don't believe, and this is across the nation, international, this is just good nugget. If you're not comfortable with a doctor that you have for whatever reason, switch. You want somebody on your team that you feel comfortable with. Number two, we often say, fire them. You have the right to ask for another physician. No doubt. You don't have to have the one that's been assigned to you. Number three, if you have a medical bill, across the board, it doesn't matter in what state you're in. If you get a bill and that you itemize, I recommend you look at the bill, no matter you have health coverage to cover it. You want to make sure that the hospital had itemized your bill, that it is valid and true. But you could also negotiate your medical bill. People don't know that that's not going to be something that I'm able to put on a fact sheet. No hospital is going to put that on their website to say, oh, did you know you can negotiate your medical bill? That's not going to be common knowledge. But when you're going to be trained and in these settings, that's what we're going to teach you. You could contact the administrator and say, this will create a financial hardship. Now, I know individuals who have 6 figures have done this and not pay for services. So it doesn't matter what social economic status you are, you have a right to negotiate your medical bill. You could say it will create a hardship. Is there a way that you can reduce my expenses? If you don't ask, you won't get it. That even applies to dental. Oftentimes the dentist will say that you need $20,000 worth of dental work. Well, get the itemized bill and you'll be surprised that a quadrant that antiseptic is going to cost you anywhere from $85 to $125 per quad. That means you have 4. That is this antiseptic that they believe that will prevent prevention of infection. Well, you could deny that and say, I want to save $85 times 4, because that's almost $400 just for squirts of antiseptic in your mouth. You could say, is there another alternative? And also, salt water is still a good remedy from the olden days as well. But if you don't know to ask and say, I don't want that on my bill, you'll be paying $400 on an expense that you really don't need. They recommending. So that is what we empower to help you to become your own advocate, so you can ask the right questions. Yes, they get annoyed, but it's your money, right? When we're in business, the business goal is, how much money do I keep in my pocket? Is the ultimate goal. And for personal finances, is how much money do I keep in my own pocket? Another tidbit that I always share with individuals is always ask your physician. If he's asking or prescribing medication to you for the first time, ask for samples.
Oh, okay.
Because it may not work. You don't want to pay $200 and find out it's adverse reaction or doesn't work. Now you're at a $200. Now the doctor is there, not at his fault. He's prescribes medication he doesn't know. But ask, do you have samples, or is there a generic?
And that's very important. Yeah. Because I didn't know to ask for samples or these kinds of things. So we need to, as we try to work with the chamber and the foundation, that we possibly need to put a nice workshop together, maybe for late November or early November, so people go into the season and the time, especially with all of these pandemics and shots and these kinds of things. People are refusing to take more shots, all kinds of things about, well, they just made that up, and now we got the monkeypox, and we got this, and we got a shot for that, and a shot for that. You still need your flu shot. And a lot of the seniors are, they're already taking a bunch of other medication just to keep their mobility moving. And now we have an array of shots that will keep you from doing this and then keep you from doing that. And it appears that a lot of the shots are free. And, people are suspect when the government started giving out free medical care. So are most of these new shots now free to the public? Or is it a part of the policy? Do you know that?
Are you referring to the boosters for COVID?
The boosters for COVID and the boosters for this, and now there's a new shot for that, and we are bombarded with healthcare commercials, and then at the real end of the commercial, if you do this and all of the other stuff, and it's like, well, I need that shot, but I'm afraid of all of the other stuff that may come up. And it's like you say, the doctors don't know that effect until after they've treated you or given you some medicine, and you come back in, this stuff is making me sick, as I can't sleep, or whatever the case may be. What do we say to the seniors about taking the shots? Because I think that's where most of the COVID shots stop at, because seniors are taking medication for other things, and they don't know how that's going to affect it. And we were going in to get our flu shot regular, every year, but now you've added 4 more shots to it. Are you having communications with seniors about, I know the information, you can't say don't take the shot or do take the shot, but the information about the shot, are people coming to you with that?
Yes, that we always share with individuals, it's your choice. We want you to be informed so you can make your own informed decision, that whether the booster is what you want to take based upon what you're hearing from a a pharmacist or a medical doctor, because again, those are the individuals we bring in because we don't provide medical or health service advice. However, we bring in the experts so you can make your own choice. And I often tell every individuals that if you're in doubt about anything, research it for yourself, that it may not be good for you. Oftentimes individuals didn't realize that the flu shot isn't necessarily 100% efficacy, meaning that the flu shot may only be a percentage that 60%. So you may not even know that. That is the reason why we do the workshop. So you could ask the question, well, ask the question like, okay, is this flu shot that you're recommending, what is the efficacy? Oh, it's 50%. Well, then you could say, well, no, I think I would want it to be around 80.
Yeah.
And it's okay but that is knowledge that you need to know about. Or we also into holistic health or keeping yourself healthy. Are you walking? Are you exercising? Are you moving? Are you drinking water? So you can get off of some of the medication, because those are not miracle pills. That one, and remember, more medication you take, it adverses something else. So we would want you to make sure that you're operating at your optimum health, meaning that you're doing some of the natural things, even from your mental state. Are you spending time quietly? Are you watching too much news? Are you living in a stressful environment, whether it's your home or your neighborhood? How are you able to get your spiritual mindset to help? Because that also impacts your overall health. That helps with your different types of cancer. It's stress related, but my stress and your
And
stress.
getting your spiritual mind together is so important. Yes, you've frozen on my end again. I wanted to have you one more time tell us about the event on the 25th as we wrap this up.
I will. Reminder on August the 25th from 5 p.m. to 7 p.m. with light refreshments, that we're coming together as business owners to connect and to be encouraging to one another, and how we could support one another in our businesses, because we want to be a part of wealth building. Because as well as health, with no health, there's no matter with your wealth. So I would love for those who are able to come and join us. It is going to be a small, intimate gathering. We will be asking you to wear your mask and take the precautionaries to make sure that we all stay healthy, and that to be able to still support one another, to grow together, as well as build our own networks, as well as build our own wealth.
Fantastic. I think the health portion is so valuable, and unfortunately, we don't think about it until we get sick.
Mm-hmm,
We don't think
mm-hmm,
about not walking till we can't walk. So
mm-hmm.
it's so valuable that we begin to pull things together. And I think having a health fair, doing a workshop, is something that we should probably look at before the end of this year, and finding a location and bringing people together, because it is necessary. And everyone, and I want to say everyone, and you normally don't say everyone, but everyone has lost someone in the last year or so in these different pandemics or just different health reasons. Um, uh, uh, Cancer has run rampant, and the cigarette people have figured out another way to sell cigarettes through, what is it, the vaping
Mm-hmm.
and the flavor vaping. So they've found a way to reach into our young people's mind and give them peppermint flavor. And when we were young, smoking cigarettes was cool. I mean,
Mm-hmm.
in fact, that was the name of a cigarette. I don't know if it's still out there or not, but
Mm-hmm.
it was a cool thing. We saw it on TV. It was in the movies. It was over here and it was over there. So we were being directed, or uh, directed into being able to do things that were going to be harmful to us later. I think that's still happening today, not just with cigarettes, but with other things. You mentioned water. What is the normal intake of water a day a person should be taking? Do you know what that is? It
It
varies.
It varies because it depends on your diet as well, because there's vegetables and fruit that also contain water. So I think the last nutrition fact that I saw, anywhere from uh, 8 glasses of water at 8 ounces. But you can measure that yourself. Some require more depending upon the body weight. And just to remember, though, that our bodies is over 90% water. So if our bodies are over 90% water, we need to drink more water. And I'm talking to myself, because I believe in being authentic, that that's a struggle, but it's necessary. And I want to make sure that we make healthly choices as a cool choice. That is cool to be healthy.
Fantastic.
And also, in
I
fact,
think that's a great thing.
Mhm.
I would like for you to finish out with a statement that you would want to leave us with. You're frozen on my end, so maybe I might not get to hear it, but there we go. If you could leave us with a statement, I thank you so much for coming on today. I really appreciate it. I'm going to be seeing you on the 25th, and we're going to sit down. Tell everyone we're going to sit down in one of our 12 to 15 chapters, and we're going to put together a health fair. I've got the City of Hope already willing to do it. We're tied into some other health issues and health things because we want to come into 2023 healthy, wise, and ready to rock and roll. So we're going to finish up these last 2 quarters in a good environment to make things work. So if you could leave us with something, Miss Wright, we will get back. Yes, ma'am. So let us know. Give us a statement on the way out.
One nugget is take one thing every day to become more healthier. If it's one more glass of water, do it. If it's 5 more steps a day, do it. If it's eating one extra a piece of fruit a day, just start small. But we want you healthy because our communities are dependent upon all of us to be able to be progressive individuals and to be an example for our community and for our young people. They want us around, and I want you to be around too.
And I want you to be around so you can watch Strictly Business from Edge TV. We're getting a lot of people in our chat that wants to know where the event's being held. You can go to our website at blackchamberofcommerce.org. We're going to put that event up on our event page, and we're going to be out now. Is there an RSVP? Because I know you're trying to keep the crowd not a crowd. You want it to be an intimate situation. Is there an RSVP that people have to do,
No.
or they just show up and because we'll show up and show out?
Just come, because it's informal, so people may come to see for a moment or two and leave. So no RSVP. We just want you to come.
Okay, all right. We'll see you then. This is Rich Wallace with Strictly Business, and I have Ernesta. Is that how? Ernesta Wright?
Yes.
As our guest today, bringing in some health information. I think this is going to be Health Week, Business Health Week. Tomorrow, we have some health people coming on from the insurance industry to talk about how to get that insurance. And we will pin them down about signing that policy, because these are insurance agents and walking away with making sure that people are not necessarily informed on what they just bought. So this is Strictly Business. I thank you so much for being a part of it. And we will see you tomorrow morning at 7 a.m. And thank you so much, Ms. Wright, for being a part of this show that we are now signing off for. Strictly Business, Rich Wallace, EdgeTVNetwork.net. Thank you. See you tomorrow morning at 7 a.m.